Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Classification of diabetic retinopathy. No diabetic retinopathy, that means there is no abnormality. Then, then there can be mild non-proliferative diabetic retinopathy. In mild non-proliferative diabetic retinopathy, here there is microaneurysm is only present. There is only microaneurysm in mild non-proliferative diabetic retinopathy. In moderate non-proliferative diabetic retinopathy, there can be microaneurysm along with something else, but it is less than severe non-proliferative diabetic retinopathy. So what is seen in severe non-proliferative diabetic retinopathy? In severe non-proliferative diabetic retinopathy, actually here we will see that there is no signs of proliferative diabetic retinopathy, and along with that there should be presence of any one of the following. What are they? There should be intraretinal hemorrhages should be present for at least 4 quadrants, that is more than or equal to 20 quadrant, or actually more 4 intraretinal hemorrhages should be present for at least 4 quadrants. Okay, intraretinal hemorrhages for 4 quadrants. Then venous bleeding should be present for more than 2 quadrants, and intraretinal microaneurysms should be present for more than one microvascular abnormalities, or intraretinal microvascular abnormalities should be present for one compartment. So this is called as actually 4-2-1 rule. If any one of these is present, then it is diabetic, severe non-proliferative diabetic retinopathy. If they are present but they do not fulfill the quadrants 1 along with microaneurysms, then it is moderate non-proliferative diabetic retinopathy. So in severe non-proliferative diabetic retinopathy, there should be 4 quadrants of intraretinal hemorrhages, 2 quadrants of venous bleeding, and 1 quadrant of intraretinal microvascular abnormalities. Then proliferative diabetic retinopathy. In proliferative diabetic retinopathy, there should be presence of neovascularization and presence of pre-retinal or vitreous hemorrhage should be present for proliferative diabetic retinopathy.
thank you and thank you for watching.